In this video, we will talk about the health record and why the health record is so crucial if you apply for insurance. So if you consider private health insurance to have access to the best doctors, if you consider occupational disability insurance to protect your income, or if you consider life insurance to protect your children and also your spouse, then you should definitely watch this video to the end. So let's get started. If we talk about the health record, we mean the health record, the patient file of your current statutory health insurance. Because you are eligible to just send your statutory health insurance an email and ask them for your patient file. In this patient file, all your doctor's appointments and the specific diagnosis is mentioned. Also, the specific dates are mentioned in this patient file. So if you apply for private health insurance, occupational disability insurance, or life insurance, you always have to do a so-called health condition check. You don't have to go to a doctor, but you have to answer a questionnaire properly. If you miss out any information, you might have issues getting benefits from the insurance companies. This is, I don't want to say the only reason, but this is the main reason why you have issues with any payment from the insurance company. It's, let's say, 85% depends on the insurance company. 80% of the reasons why an insurance company is not paying is because you weren't fully honest in your application, because you didn't mention all your doctor's appointments and the specific diagnoses which are connected to a specific doctor's appointment. What is now the consequence? So let's say in private health insurance, you didn't mention that you are taking any medication, for example. Okay? So let's say you don't you take any medication, you apply for private health insurance. So scenario one. If they now find out, because especially in the first 1 to 3 years, depends on the health insurance company, they double check what you have mentioned in the health condition. So they just might ask the doctor, okay, any pre-existing conditions? Is the doctor aware of any pre-existing conditions, let's say in the last 3 years? Then the doctor says, yeah, he took any, or she took any medication. So now it depends how crucial this is for the insurance company and how bad any diagnosis is. Then they might cancel your contract. If an insurance company cancels your contract, applies to more or less all the insurance out there, it's really difficult for you to have access to a new insurance company. So in that case, the only option would be to switch to a private health insurance with benefits like public health insurance. So let's say a public health insurance or statutory health insurance. And then you are stuck in this insurance. And this is obviously a huge disadvantage, because if you were honest in the beginning, always honest because you were honest, but you might forget something or forgot something. If you didn't tell the full truth about your health condition, then you have the issue that they might cancel your contract. But if you would have done it correctly, you just might have the option to switch to another provider which doesn't have any issues with this pre-existing condition. Okay? So this is what you definitely have to consider if you switch to private health insurance. Second option might be that they, one second, let's make it pretty. So second option would be that they increase your premium because you receive a risk surcharge, and you obviously receive this risk surcharge retrospectively. So now you have to make a one-time payment, for example, because you didn't opt correctly for private health insurance. Worst option, option 3, would be they cancel the contract retrospectively. And then you can probably imagine if they paid for any doctor's appointments, then you have issues. So if you do this correctly with the health record, nothing can happen because everything is mentioned there. And if the private health insurance would like to double check, they would just ask you public health insurance for the health record. Then they see everything what's mentioned here is also properly mentioned in the application. Easy. This is how you apply for private health insurance. If you didn't have any doctor's appointments in the past, then obviously we don't need that. But if you just have small uncertainty when you went to the doctor, what happened, what was the diagnosis, which medication you took, then you should definitely ask your public health insurance for your patient file. Then you send the patient file to your advisor. The advisor works through the whole patient file, comes back with you with questions. Then the advisor is doing a so-called anonymous risk check. So the advisor would send your information anonymously to an insurance company or to all insurance companies. Then we have the feedback, and then we can make an informed decision for or against any specific private health insurance company, for example. Same applies to occupational disability insurance, and this might be even worse here. Because you have occupational disability insurance, let's say to protect your income, so you insure, let's make it easy, 3,000 euros. So in the event of occupational disability, so any mental issues, physical issues, any accident, disease, whatsoever, doesn't matter. They pay you 3,000 euros until you can work again. Makes sense to consider to protect your income, to always be in the position to save money and to cover all your expenses. Now you insured 3,000 euros. Now, worst case, you are occupational disabled. What they will do at that point, they don't do it earlier like private health insurance. At that point, they will double check your application. They will ask you, they will ask for your patient file from the public health insurance. They will ask your GP what happened in this specific time horizon. And when they find out that you didn't mention everything correctly, also here, either they cancel the contract, they don't pay benefits, or don't pay the pension. And then you paid for an insurance company, and this is the most annoying, paying for an insurance company and not receiving any benefits. So please keep that in mind also for occupational disability insurance. In my opinion, if you applied for private health, occupational disability or life insurance without your advisor taking the patient file from your public health insurance, is actually pretty unprofessional and might cause issues for you in the future. Really important. Also for life insurance, well, obviously same procedure here. Either they cancel the contract or they don't pay, because they might say, if we would have known that upfront, then we wouldn't have given you the policy. So the whole insurance protection is not valid anymore. And then you can probably imagine, if you pass away, your spouse needs that money maybe to cover any real estate loan, and then the money is not paid because of this. Difficult situation. Losing the spouse plus having no money in combination. Yeah, difficult situation. So if you consider this, and it's not a lot of work. Maybe it sounds like it is a lot of work, but it's more work for your advisor actually. So if you just send an email, one sentence, please send me my patient file for the last 3 years in private health insurance and for occupational disability insurance, for example, for the last 5 years. If they send you the patient file, you just forward it to your advisor. The advisor is checking everything, getting back to you with probably many questions to actually do the application properly, and then you don't have any issues with your private health insurance and also no issues with occupational or life insurance. Some people claim, yeah, private health insurance, they don't want to pay, and then you have issues with them and so on. Well, this is not true. It's only true if you have done a mistake while, let's say, signing the application. Okay, it's not the mistake of the private health insurance company, because otherwise, if they don't protect the insurance community, and many people move to a private health insurance which shouldn't move to private health insurance, yeah, then we would have even bigger issues and the whole system would not work. Okay, so it's crucial to be fully honest with your health record. If you would like to have help switching to private health insurance, applying properly to occupational disability insurance, protecting your children or your spouse, and you would like to have really professional advice so you don't have any issue with your insurance in the future, feel free to reach out, visit our website proper-api.de, register for a free initial consultation, and we will see what we can do for you. Possibly talk to you soon. Take care.